Bedwetting in children causes, management, and when to see a doctor. Bedwetting is the involuntary urination by a child at night, typically occurring between the ages of 5 and 7. It's a common issue, not something to be overly concerned about, and most children will eventually outgrow it. One main causes of bedwetting: delayed bladder control development. Some children take longer to develop bladder control, especially at night. Genetics: if parents had bedwetting issues as children, their children have a higher likelihood of experiencing the same. One main causes of bedwetting: deep sleeping. Some children sleep very deeply and may not wake up when their bladder is full. Stress or changes: factors such as a change in living environment, emotional stress, or alterations in daily routines can also affect a child's bladder control. 2 children and development differences. 2 children and development differences. Although children develop at different rates, bladder control typically occurs within a certain time frame. Some children may achieve daytime and nighttime control early on, even at the same time. However, for other children, this process might take months, years, or even longer before they can fully control their bladder and avoid bedwetting at night. 3. Bedwetting in children is rarely caused by medical issues. If a child consistently bedwets after they have been reliably dry at night, it is likely not due to a significant medical reason. However, parents should still be aware of changes in their child's daily routine related to bladder control. 4. When to see a doctor: if a child who has been dry at night suddenly starts bedwetting again, or if it's accompanied by other symptoms, such as fever, painful urination, it's important to take your child to a doctor or a healthcare facility. Physical issues, most commonly constipation, urinary tract infections. 4. When to see a doctor could be responsible for these symptoms. 5. Managing bedwetting in children: patience and a supportive environment. Bedwetting isn't your child's fault. Show them love and patience, creating a positive environment where they feel comfortable and secure. 5. Managing bedwetting in children: supporting your child. Work with your child to establish a consistent toileting routine, limit fluid intake before bed, and help them gain confidence in bladder control. Medical support: consult with a doctor for advice and appropriate medical assistance if needed. Note: bedwetting is not something to be worried about, and most children will overcome it as they grow older. However, if the condition persists or there are unusual changes, consult with a doctor for a diagnosis and timely treatment.